very simple maneuver that you can do. Not necessarily, but it's something on the mama's belly. What do you do? So if my stomach's stuck, what you say? Well, that's uterine massage for the bleeding. But push down. Push the shoulder down. So the bone is here, and I'm turtling against the shoulder bone. All you do is push suprapubically, right here on the mama's belly. Push the shoulder down, and then the baby will slide out underneath the pelvic bone. So I forgot what that maneuver is called, but it's very common.
McRoberts?
I think McRoberts when you put the legs in. I wish it was talking about.
I forgot names at this point.
But that's basically what you do. You literally just put pressure on the baby's shoulder. I mean, it's a very simple procedure that can, save the baby's life. Because the baby's stuck there, and the cord is stuck and getting compressed on the way out and things like that. They might not be getting, great blood flow. So.
Dr. Amir, can you repeat the part again where you say move to the left side?
What'd you say?
Move to the left side.
Yeah, just roll around to the left side.
Can you explain that one more time? I'm recording it.
Oh, yeah. So you have two major blood vessels. One is the inferior vena cava coming back up to the heart, and then the aorta comes off to the heart and it feeds the rest of the body. When the baby's sitting here and mom's laying directly on her back, the baby could be smashing the vessels. So the aorta is thick, it's fibrous, it's a really big artery. It's harder to smash. The IVC is a vein, very thin, very flimsy. So the baby could be smashing it off nearly completely, and that can drop the blood flow into the heart. Mom could pass out, et cetera, so forth, and go into distress. So a way that you can alleviate that is simply, instead of having mom laying directly on her back, just roll her to the left side. Roll her slightly onto the left side. You can put a pillow back here, you can put a blanket back here to help pull the baby off the IVC and pull it more towards the aorta. So left lateral, yeah, kind of like Lieutenant Q has baby, or has mom. Yeah. And then the shoulder maneuver is,
So like,
baby's head is some babies gonna come out like that, but most of your baby's gonna come out probably like this, and then baby's shoulder here is stuck against the pelvic bone, if you wanna show them the pelvic bone. So this bone right here in front, so if baby's shoulder is stuck here, something you can do is simply take mom, so where you're delivering baby, your partner, so you're just resting your hand gently on baby, your partner can take his hand or her hand and push down to help push. Okay, can we get some grease on this baby? And then basically you're pushing that shoulder down, so and then baby will pull up slightly and baby will come out. Hey, baby. There you go.
look at that,
That's
huh?
the down and up maneuver I was talking about. Down, down.
And then this is gonna go like,
Yeah.
make sure we get the yeah, that.
And this is just like a
Placenta.
little thing since you're mentioning the placenta.
It's-
A lot can be really fragile, right? Like you can, like some are very like strong and sturdy, but some are not. And so like don't yank it. Like let it. It's gonna deliver just like the baby. So you can continue to do that uterine massage we're talking about to reduce the hemorrhage. And by doing that, you're slowly pulling on the cord and slowly kind of turning and pulling as it's coming out. You don't want to yank the placenta out because it can fall. If you like yank it out and it doesn't come out in a nice circle, then now you have these leftover products that are inside mom, and that's just something we don't want to do if we can avoid it. Slow and steady. Slow and steady.
The moms have the right to keep the placenta.
Oh yeah. Yeah.
I got an interesting telemetry call about that. Mom did not want to cut the cord, and that was an interesting telemetry call. But nonetheless, I just wanted to say that you want to be careful where you're holding baby, because if mom delivers, and you've got baby here, the blood in the baby is going to follow gravity. So if you're holding baby above mom this whole time while mom is like down low, what you could do is end up, draining a lot of blood here. Blood's going to have a harder time getting back up to baby, because the placenta is no longer attached, doesn't have that pulsatile flow anymore. So you want to make sure after you suction baby, dry baby off, put baby onto mom's chest. That's the safest place at the level of the heart. So, and moms love baby on the chest.
Early contact.
all right. Any questions? Gripes, complaints, anything you didn't know, anything you need to learn, anything you didn't learn? All right, take,
There's one more question.
oh, I'm sorry.
We were learning about cycling, the movement of the fetus down into the pelvis rate to pregnancy, and I couldn't find a video about what that looks like.
what, moving the shoulder out of the,
No, it's the movement of the fetus down to the pelvis away from the pregnancy. So there's not actually it doesn't look like anything, it's a feeling of lightning. With the baby moving down, you're like, and then you're feeling like lightning, so that's what it is. It's a sensation,
yeah,
lightning.
yeah, like getting shot.
Basically.
Any more questions?